Thank you. I'm Kate Hobbs Knutson. I'm a child and adolescent psychiatrist at the South Boston Community Health Center. And today I'm going to talk about trauma in children. And this talk really grew organically from my experience at the health center. Within 2 to 4 months of working there as a psychiatrist, I was struck by the burden and the ubiquity of the trauma that these children had experienced. I'm also going to talk about the potential response we have as a community to these issues. So an estimated 2/3 of children in the United States experience trauma. And trauma is broadly defined as any horrific event where an individual fears significant bodily harm or death for himself or those around him. And this is particularly challenging if the child fears the death or harm of a loved one. This is an aerial view of the old colony projects in South Boston. We know that trauma disproportionately affects individuals living in poverty. It's been shown that males, ethnic minorities, and urban residents are all at increased risk of witnessing violence and have a higher prevalence of PTSD. We also know that single moms living in poverty have higher prevalence of PTSD and are more likely to have experienced multiple traumatic events in their lifetime. So we know that the governor declared an epidemic of opiate overdose deaths. And in Boston, during the 4-month period, November 2013 to February 2014, it's been estimated that 185 people have died from opiate overdose. It's also estimated that in the past 6 months, 24 people have been murdered. And certain communities in Boston are affected more than others. I'm thinking about Dorchester and Brockton. But South Boston has its fair share of opiate abusers, opiate deaths, and community violence. And if you think about it, the children in these communities are growing up in homes where their parents, their aunts and uncles, their cousins are using substances, and they're being exposed to the ill effects of these issues. And there's been multiple times where kids and young people who I've seen were the first people to find their family members after an overdose in their home. And that's incredibly traumatic for anyone. So, as I was saying, I experienced this again and again and again when I first started at the health center. And I was just struck by the number of children who have experienced trauma. And so I'm putting together sort of a general patient picture to give you an idea of a story that I saw again and again. So this is an 8th grade boy, and many of these kids were referred to me were boys. And he was referred by the pediatricians for behavior problems at school and at home. And because of the Kraft Foundation, and also because I'm a psychiatrist, I get a little more time with my patients. So the initial evaluation lasts an hour and a half, and the first part of the evaluation I spend with the family together. Then I meet alone with the caregivers, then alone with the kid, and we come back together. So the way this normally goes, when we're all there together, the mom usually goes on and on about how terrible the child is doing. They're failing out of school. They've already failed 1 grade. They're going to fail another grade. When they are at school, they're having behavior outbursts. They're getting suspended at home. They're running away. They're using drugs. It's sort of the same story again and again. I meet with the parent alone, and what I hear is sadness, fear. The parents feel out of control, and they don't know what to do. And then I meet alone with the child. And I usually start with very open-ended questions. And this boy in particular was having trouble sleeping. And I said, well, why are you having trouble sleeping? And he said, I don't know. And I said, well, are you texting? Are you watching TV? Are you worrying about things? And he said, well, I'm worrying about things. And I said, well, what are you worrying about? And he just looked at me, and I could tell he was having trouble speaking. And I said, well, give me the top 2 things you're worried about. And he looked again, and I could see tears welling in his eyes. And I said, well, can you write it? And he wrote down, 1 with a circle around it. We were at a cookout, and my dad was drunk, and he was hitting my mom. And then 2, my dad was trying to choke my mom, and I was scared. I told my sisters, and we called the police. And then it was just silence in the room, and then he just starts crying. And again, this is a story I saw again and again. Usually a boy, tough guy, who, when you have the time to sit and process with him, what you see is a scared, sad young man with the effects of trauma just welling right beneath the surface. The other thing is, for myself and for probably everyone in this room, if I had experienced one of these traumas in my life, it would have taken 10 to 20 years to get over, if ever. I mean, if I had ever witnessed my dad trying to kill my mom, that would be horrendous for my life. These kids, they usually experience the first trauma very early on. I don't think the adults understand the emotional toll it has on the kids, and there's really no way to recover before the next trauma happens. And these are severe second traumas. And then again, no recovery, trauma, 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 and it's one after another. So that by the time they're in high school, of course they're having difficulty managing emotions. Of course they're not able to focus and concentrate in school. And it's almost like any one of us would have this response to the environment that the kids are growing up in. So I'm worried about these kids, as I know all of us here are. We know that trauma can have enduring effects. There was this landmark study about 15 years ago that it's called the Adverse Childhood Experiences Study. And in the study, about 10,000 people responded to a survey. And the survey divided categories of trauma into about 5 areas: psychological, physical or sexual abuse, violence against the mother, living with household members who are substance abusers, mentally ill or suicidal, or ever imprisoned. And the survey asked these respondents, have you ever experienced any of these traumas? And then if yes, how many times in your childhood did that traumatic experience happen? And what they found was astounding. Sorry, the highlighting's off here. But the gist of the study is that for people who had experienced 4 or more of these adverse childhood experiences, they were at significantly higher odds of having these chronic physical conditions: heart disease, cancer, stroke, COPD, and diabetes. And there was a stepwise correlation. So the more of these adverse childhood experiences you had had, the higher your odds were of having these physical conditions. And if you look at those conditions, those are the conditions that cause significant morbidity and mortality in our society, and also contribute significantly to rising healthcare costs, and also are significant costs for society in terms of disability and time out of work. And there's a direct correlation between adverse childhood experiences and these chronic illnesses. And the authors and others have posited that the progression from adverse childhood experiences to these diseases and ultimately early death goes as follows. The base of this pyramid can grow larger depending on the number of adverse childhood experiences you have had. And we know that children who have experienced trauma have altered cognitive pathways and also have difficulty maintaining their behavior and emotions. So these individuals are at higher risk for mental health conditions, putting them at higher risk for risky behaviors like substance abuse and sexual risky behaviors. Then they develop diseases like Hep C and others that we know about, and that can lead to early death. So looking at this progression, I'm struck by at how many levels community health centers can intervene and change the course of this trajectory in a meaningful way. First, these children are being traumatized by social ills, by violence, by substance abuse, by poverty. And community health centers can be one hub, can be one part of a collective response. So we can partner with the police department, with the housing authority, with the Department of Public Health, with nonprofit organizations, with schools, and we can create a collective response, drawing on all of our experience and our diverse resources to address these ills. And it's been shown in studies that neighborhoods with high community capacity, so community capacity is those social bonds and that collective organizing of the community using the multiple resources and expertise to address social problems, those communities are correlated with lower scores on those adverse childhood experience surveys. There are trauma-informed therapies that have been shown over and over and over again in studies to be effective, and significant evidence base for treatment for trauma. And all of our community health centers have therapists, and there are beautiful examples of community health centers that have trained their therapists in trauma-informed therapy to make sure that those evidence-based treatments are reaching those individuals in our communities who are most in need. And in primary care, we can address the risky behaviors, we can treat the illnesses, and ultimately prevent early death. So, Again, the community health center can be one component of a larger community response so that we can address these ills like poverty and violence, substance abuse, and then have a cohort of children who are not traumatized, who can go to school and focus and concentrate, and who can graduate and be, productive citizens of our society. So I want to thank my patients, first of all, for their resiliency and also their openness and honesty with me and allowing me to be witness to their experience. Thank also the health center for welcoming me. I feel like the rock star, to be honest. I've said this multiple times at my health center. They're just so good to me, and Nisha Takar in particular, who's been an amazing mentor and a friend. Has invited me into your home, taught me how to cook Indian food. Even though I haven't cooked it, I know how. And thank you also to the Kraft Center for this just forward-thinking, innovative program. And it's just an amazing opportunity that we've had. Thank you.